Welcome to our guide on pursuing a nursing career in the U.S. In this video, we'll cover everything you need to know as an international applicant, including job responsibilities, qualifications, salary, benefits, and the unique advantages and challenges you might face. Nursing is a dynamic and rewarding profession that plays a crucial role in the healthcare system. Nurses work in a variety of settings, such as hospitals, clinics, and community health organizations. Their primary responsibilities include assessing and monitoring patient health, administering medications and treatments, and collaborating with doctors and healthcare teams. In addition to providing direct care, nurses educate patients and their families about health conditions, ensuring they understand their treatment plans. This involves explaining medications, potential side effects, and lifestyle changes. Nurses also maintain comprehensive patient records, essential for continuity of care. As the first point of contact for many patients, nurses are vital to delivering quality care and improving patient outcomes. They not only address physical needs, but also provide emotional support, creating a trusting relationship with those they serve. This multifaceted role makes nursing both challenging and fulfilling. To become a nurse, you'll need to meet specific qualifications and submit various documents. Typically, this includes obtaining a nursing degree, either a bachelor's or an associate degree. You must also have a valid nursing license and complete the NCLEX RN, or an equivalent licensing exam, which assesses your competency to practice safely. Additionally, proof of English proficiency is often required, with standardized tests like the IELTS or TOEFL being common benchmarks. You may also need to undergo background checks and health assessments to ensure you're fit for the profession. It's crucial to research the specific requirements for the state or country where you plan to work, as these can vary significantly. Understanding these prerequisites will help you prepare effectively and navigate the application process more smoothly. Nurses in the U.S. enjoy competitive salaries and a robust benefits package. The base salary typically ranges from $63,720 to $132,680 annually as of 2023, influenced by factors such as experience, education, and geographical location. In addition to salary, nurses often receive a variety of benefits. These may include health, dental, and vision insurance, retirement plans, and generous paid time off. Many employers also offer support for continuing education, which can be invaluable as you advance your career. It's essential to review the specific benefits offered by potential employers. Understanding these elements can significantly impact your overall compensation and job satisfaction. This information allows you to make informed decisions about your career path and workplace environment. Like any career, nursing has its unique advantages and challenges. Among the advantages are job stability and a strong demand for nurses. This demand often translates into numerous job opportunities across various specialties. Many nurses find fulfillment in the ability to make a significant impact on patients' lives, helping them heal and navigate health challenges. The personal connections forged with patients can be deeply rewarding. However, nursing also comes with its challenges. Long and irregular hours can lead to fatigue, especially in high-stress situations. The emotional and physical demands of the job can be considerable, as nurses often encounter critical and life-threatening situations. Understanding both the advantages and challenges of the profession is crucial for anyone considering a career in nursing. Being well-informed will help you better prepare for the realities of the job and enable you to make a meaningful impact in the lives of others.
So as a nurse working in a hospital, the beginning of the day involves me arriving, clocking in at the clock-in machine, putting away my meal for the day in the break room, and getting my assignments for my patient. So overnight, the charge nurse assigns my patient that I'll get for the day. And so I go find the nurses that have my patients overnight. and I get a report. So they tell me brief medical history for the patient, any significant events that happened overnight, anything I need to know, anything that's relevant, anything upcoming that I need to be aware of that will occur during my shift, any factors involving the patient as far as personality things, family things, any relevant information that nurse will know that maybe not, that maybe isn't included in the chart. It's things that nurse tells me about the patient during report. So once I get report, I go meet patients and I introduce myself, let them know who I am and what the plan is for the day. I go then look at the patient's chart. I do a deep dive, take notes on anything that is relevant about the patient that I need to know. I send some emails, make phone calls based on what I can see in the chart that I might need to know about from other members of the care team, the patient's care team. We also do morning huddle with other nurses and then with nursing leadership for the day shift, just to make sure we're all on the same page. I talk to the tech, the nursing tech that is assigned to me and my patients for the day to make sure that we're on the same page. And then things begin. All of my nursing tasks I have to complete within that 12-hour shift. So I typically make a plan for the day and I make notes on that plan. Early in my career, I took very meticulous notes and was very detailed. I wrote everything down on a piece of paper, but over time, I was able to compartmentalize and structure my thoughts and my tasks in my head pretty much for the day. On a good day, I'm able to leave the unit or even just sit down to take lunch, to drink water, to go to the restroom, and to do the things I need to do to take care of myself. On a really tough day, I'm not able to do those things. And for a full 12 hours, I'm running around to make sure that my patients are taken care of. On various units, the number of patients that I'm assigned to would depend on the level of acuity or how serious the patient's condition is. On the unit that I work on with brain cancer, patients are sometimes post-op, meaning they just had some kind of a brain procedure. And so if I have a patient that is freshly post-op, then I likely will just have one or two other patients, maybe 2 to 3 other patients in addition to that patient who's freshly out of surgery. I might get a new admission or have a discharge. So there's a lot of moving parts and things that happen over the course of a shift, over the course of a 12-hour shift. So what's most rewarding about my job as a nurse is the ability to take care of people and know that I've made a difference in their lives. I have played a small part in helping them to feel better, helping to make sure that their time at the hospital is shorter, that what I do truly matters, that yes, if it wasn't me, it would be another nurse, and that who I am as an individual, that what I bring as a nurse truly matters, and that my individuality, it matters and it's significant for that patient for that day. One of the challenges that I face as a nurse is time management. There's so many things that I as a nurse need to get done over the course of a 12-hour shift. So being able to organize those things effectively and efficiently can be difficult, especially when there are random things that happen, emergencies that happen, other people's needs that also are factors in my to-do list. Those things can make it difficult to get everything done that I need to get done for my patient. So being able to walk away, to clock out and walk away from my shift, knowing that I've done everything that I could have possibly done can be difficult, because I think any nurse that I've talked to can sometimes question, did I do the right thing for that patient in that situation? And is there something else that I could have done differently or could have done better? And so those questions can be difficult. One of the other things that can be difficult as a nurse is to see people suffering, to see people in pain and dealing with very unfortunate circumstances. One of the things that we often say in healthcare is that we meet patients on their worst day. Being able to manage that emotionally and psychologically can be difficult. So keeping a cool head, even when others are in distress or are angry, can be difficult, because our central focus as nurses is to ensure that our patients are well taken care of. And that can be difficult when they're not treating us very well. So that's another struggle. Through the pandemic, one of the things that I learned to do was to take breaths to get through it. So often I found that taking a moment to recenter and collect my thoughts made difficult situations easier to endure. Because so often I found that when I was in situations that I, could reflect on and understood that I could have handled better, it was because I was moving too fast. Stressful situations only become more stressful when we allow the situation to get the best of us. And so taking a moment to take a deep breath and remember the big picture. Remember, this is not my entire life. This is just a moment. It's just one situation. It's just one day, one shift. I will get past this. I'll go to bed tonight and wake up the next morning and everything will be different. I just need to get through this. So I've worked with many nurses of international descent or international origins. And one of the things that I've heard them mention is understanding the culture and understanding the language as much as possible is a big factor. And so that is a piece of advice I would give. When traveling internationally to provide nursing care, or when interested in a nursing program or a nursing role that is in a different country, understanding that country's cultures and languages as much as possible is very important. And so maintaining that perspective is important.